She is gynecologist and obstetrician with degrees of MBBS and diploma in gynecology and obstetrics. She is also a fellow of International College of Surgeons. She is also a member of Inner Wheel, a network of spouse of male Rotarians. Thus, she is actively engaged in supporting the community and the needy people. Currently, she is engaged as a senior consultant gynecologist in Valley Hospital, Putalisara, Kathmandu. So let's hear from her extensive and close experience with mothers of different ages, which is the major mental concerns for our mothers. Up to you, Dr. Bimla ma'am.
Namaste and good evening, everybody. And thanks for the introduction. First of all, I would like to actually thank the Rotary Club of Mount Everest, Lalitpur, for giving me the opportunity to share my knowledge on the maternal mental health. Actually, Rajeshji has already, I think, highlighted everything. I think I don't have to say much. But I just want to say that health is a state of mental, physical, and social well-being. Before, actually, when we were students, we would mostly concentrate on the physical, actually, well-being. But nowadays, most of the women, they have been psychologically depressed. So we are concentrated on the mental health also. It is seen that about 10 to 15% of the women, they have postpartum depression. And this is called baby blues. And the psychologists actually, they started, researching why this happens. And it is said that about 10 to 15% of the women, they have these baby blues, that is postpartum depression. And it is not only the mothers, as we see, I think in most of us in this hall also, like most of us, we have had some depression or the other during some time of our lives. So it is seen that most of us, actually, we all should know about the mental health and also about the depressive psychosis. Actually, because I think Rajesh has already highlighted most of it. So I'll just go into the clinical details only since I'm a clinician. And I see that most of the cases that come to the hospital and even to the clinics, they are mostly the infertility cases nowadays. Usually a young mother, she's just 24 or 18 years, as Rajesh has said, they come to the hospital and then they say that they don't have any children. They come with their mother-in-laws or their parents. Every month they visit. And then they're just depressed because they go from one hospital to the other, from one clinic to another. And then, they are just mentally exhausted. And then the mother-in-law also accuses them, saying that you don't have any children. So the husbands are going to again remarry. And then they go into depression. So this actually, the whole family actually tortures this patient and they go into mental depression. And even once she conceives also, she still has that stigma. Like in the whole 9 months, that she has been accused by her mother-in-law and even by the relatives and the social well-being also. They all accuse her. They say that, oh, she didn't get a child and all. So that stigma continues for 9 months. And in the time of delivery, she has this postpartum. The second is the habitual abortion, as it is said. Like even though she conceives, actually, she may undergo abortion due to some reasons or the other. So it may be about 2 or 3 abortions. So this also causes mental stress to the patient. And then even after 9 months of pregnancy, at the end, she still has that fear. What's going to happen next now? What's going to happen? Will I have a normal delivery? Will I have a normal child or not? So this is another stigma that the patient has and that the patient goes into postpartum depression. The third is the sex determination, as I've mentioned. I don't know if it was mentioned by Rajeshji or not. But then the patients, they have one girl child. And then, the mother-in-law again, she says, no, you have to conceive again, to have another child again. And then they have another girl child, And then the mothers force them to abort the child. And then this has another stigma, the woman. So this is another sex determination, but it has been banned nowadays by the government. Most of the ultrasonography doctors, they are banned to, determine the sex. So then but still the mother also has the same fear that if it's a female again, now, the mother-in-law is going to go and, they will say again remarried or get about this child or not. So the fourth is the anomaly ultrasonogram that is being done nowadays at around about 19 to 22 weeks of pregnancy. And then during this anomaly scan, if the baby is normal again the mother has that stigma, like whether to continue the pregnancy or not. Some people say if it's a small minor abnormality like cleft lip or cleft palate, this can be corrected. But then still the patients, they feel like, it has to be aborted. Even the mother or mother-in-law, they say, no, we cannot bear this child. So you get this child out. So then she has again that stigma and then she's psychologically depressed. And there are also certain medical histories like diabetes, hypertension, thyroid, which is very common nowadays in pregnancy because of the stress of the work in the hospital or in their own work. And then they have the same stigma till 9 months of pregnancy. So now, as already I've said, they are already 9 months, like the patients, they're very worried whether this baby is going to be normal or whether she'll have a cesarean section or not. And most of the women these days in the hospital and in the clinics, they prefer a cesarean section. They say that, we don't want to have a normal delivery because they're all scared. Like during the process of the normal delivery, they may even have some birth defects and some, abnormal bleeding. So they read up so much in the Google and all. That's why, they have the psychosis. So the last is the postpartum psychosis, which the patients have after the delivery. Actually, they say about 10 to 15% of the patients, they have this postpartum psychosis or depression. And they are super added by certain depressive psychosis during the pregnancy itself. They may be having history of schizophrenia, they may be having bipolar disorders, and 50% of the patients, they have no reason are there, but still they have this depression. And there are unmarried mothers also, rape cases, carry the pregnancy for 9 months. I've still got a patient who is unmarried and she is still in the hospital. We had a cesarean section for her. We don't know who's her husband, and she's still in the hospital, and we don't know where to refer this case. Usually these type of cases, these type of mothers, like we discharge them, but then usually when we discharge them with the baby, they usually try to kill the baby or not. And then that's why we take this baby and then we refer to Bal Mandir, or we just hand it over to their relatives. And the family torture is there, as I've already said, like when they don't have a male baby, then they keep on, torturing them, and then this psychological trauma patient bears up till 9 months of pregnancy. Most of the women, they are overworked with their job, they are pressure in their job, and then they come home very late at 7 o'clock. They still have to work with their household belongings, they have to wash their own clothes, they have to work, and then, they're all overstressed. And the mother-in-laws they usually don't understand, they have to work throughout from the morning till the end of the day. So now the referral is actually, we have to create awareness. Most of the women and most of the people, the husbands also, they're already aware about this mental health, maternal mental health, because they always Google. In fact, most of the patients, they know much more than us. They come and there are so many questions and they're already aware of them. But still, they need to be taught in the clinics and in the hospitals also. They have to be aware of this, and then we have to tell them about the awareness during the antenatal checkup. And nowadays in the hospitals, they have this adolescent health clinics. In Prasthitgriha was the first where they had adolescent health clinics. And in this adolescent health clinics, the young mothers or the young girls and the school girls, they go when they are shy to confront the doctor in front. They just go to the clinic, and whatever problems they have, they usually confide in the doctor, and then the doctor teaches them. Usually the antenatal, the family planning, everything is taught during this adolescent health. And there are also school health programs where the gynecologists and even the pediatricians, they go to a school, they fix a date, and then they talk upon some problem or the other. And this maternal mental health has also become a part of the school health program. And in some certain clinics and hospitals, not everywhere, but they have these counselors Like, it's not possible for each of the doctors to counsel the patient because it may take hours and hours to counsel the patient. That's why they have a special counselor where they, like when the doctors, they explain, but then still if they want some more explanation, they go to a doctor or a nurse or even a simple counselor or a simple ISC or a BSc a lady or a doctor who has been taught about the counseling, and they are all they have been counseled about this postpartum depression. And nowadays they have this comprehensive abortion care. Now it's called the comprehensive abortion services. It's called in the hospital. So any woman who doesn't want pregnancy below 12 to 13 weeks, they can go, they can confide, and they can abort also. But of course, that stigma when they abort, these young girls, the young school girls, they are given the privilege to abort, and it's a free. They have to pay minimum amount of money. But then when they abort 2 or 3 times, it's the patient's right, they say. But of course, they have the stigma later on when they're pregnant. They still feel like, I've aborted 2 or 3 children, or 2 or 3 abortions I've done. So they have that stigma in their mind. So the medicine actually for maternal mental health is actually caring, sharing, and understanding each other. And of course, the mother-in-law, the husbands, they all play a major part. Thank you. So this is only the clinical point of view. Rajesh ji has already described in detail.